Thanks to everyone. My name is Justin Dubin. I'm a urologist in South Florida at Memorial Healthcare Systems. I think it was great. It ended up working perfectly because Juan did such a great job highlighting telemedicine, things to consider. I'm going to incorporate a little bit of telemedicine because what we're going to be talking about is direct-to-consumer care and men's health. And I think that we need to really understand here is that direct-to-consumer care, we can't be the old man in the clouds yelling at the clouds. It's here to stay, and we need to understand that there is value for us, and we need to understand how they work, how our patients work, and how they like it or why they're going there. So I have no disclosures. So the outline today, I do want to quickly highlight the telemedicine advantages and disadvantages because it's going to go into this idea of men's health and telemedicine, which leads to our understanding of direct-to-consumer telemedicine, and then the conclusions about them all. So obviously there's some advantage of telemedicine. It works. It's easy. Our patients like it. In the men's health space, it's young guys who know how to use computers. They know how to access these portals. It's not a problem. They want to, and just to comment on what Juan said, the access to care is so important. Guys who don't want to sit in an office or come and sit in an office and announce that they have erectile dysfunction to everyone or announce to the other people in the office that they have an issue with a libido. This is their chance to actually communicate with you from the comfort of their house or their work office. It saves patients money, travel. They don't have to take off of work, efficient use of our clinic time and resources. I can't tell you how many patients, even though I've been running late for telemedicine, they're sitting at home or they're sitting at their office and I apologize for being 20 minutes late. They go, hey, listen, it's better than being in the office, right? So I'm sitting at home, I'm doing work, I'm doing what else I need from the privacy of my home. So they actually don't really mind that tardiness sometimes. It's better than being in the office. We are all limited with our MAs. We're limited with our nurses right now. So it's just one extra step that we can remove from rooming patients, having them deal with other things or people that need to be seen. And obviously, the big thing here for men's health is stigma. There's a huge men's health stigma. Guys don't want to talk about it, and they specifically don't want to talk about it in a public place where they have to go. And we're going to highlight that issue right now. So the majority of patients we know go online for health information. Men's health information on these platforms, unfortunately, on Instagram, TikTok, we know it's not accurate. It's not given by providers. And this stigma of seeking care or even, receiving care is one of the major barriers that patients face in getting the care they want, right? All guys picture themselves as being, the liver king, right? We're all jacked. We're thinking about having the best sex of our lives, having, our partners happy. We're having a family, and something goes wrong. Your erections aren't what they used to be, or you no longer have that sex drive that you wanted, and you're ashamed. You're embarrassed, and the last thing you want to do is go somewhere to see someone. Why can't I do this from my house, right? And try and fix it there. Privacy over cost and convenience. And I'm going to highlight this. This is a huge concept when it comes to direct-to-consumer. People are willing to pay for anonymity. They're willing to pay to not be seen by anyone else in the public space to talk about their problems. And they're willing to pay more than insurance will cover. And so this is a really great opportunity for us as men's health providers to really get into the space and get to people who maybe are not getting the care they should be getting or improper care from other people or reaching people who otherwise wouldn't get care. Obviously, there's disadvantages. Juan did a great job highlighting them. There's technological barriers. There's data security concerns. There's the lack of the physical exam where, the guys at UCLA did some great work highlighting that aspect of it. And then, the reimbursement and regulatory issues that are coming down the pipeline. I do want to quickly talk about, male infertility, telemedicine, and it does highlight this stigma. Only 29% of men who are concerned about their fertility are likely to discuss their concerns with a provider. That is an insane number. And especially when it's a route of two people have the burden of couples infertility, and one of them doesn't even want to deal with it, even if they're worried about it. Men, there's so much data on this, will prefer to perform at a home semen analysis than in a lab. And you can ask any human being that makes sense, right? Do I want to go ejaculate in a random cold, sterile room, or do I want to do it at home with my partner, watching porn, whatever the hell you want to do? It just makes sense. At-home fertility kits work, they're accurate, they're data-driven, and we also know that telemedicine has been an effective way to get patients in the room. I can't tell you how many men I can get to through telemedicine for infertility who wouldn't step in the door, and obviously the exam is an important part, but that's the follow-up visit. Getting the trust, getting the conversation going is so important, and especially in the fertility space, it's a great way to get that conversation and getting the trust there. And that goes to that last point there. When we're talking about men's health, this year, the AUA and SMSNA did a great job of creating a white paper. And the truth is, most of men's health things can be addressed via telemedicine. And we know that, and that's why DTCs know it, and we're going to go into that conversation. But, in general, the AUA guidelines do require a physical exam or assessment of these issues at some point. Obviously, when we're talking about access to care issues, one thing that I always recommend, I always ask my patient, if I can't see them, is do you have a primary care provider that you're seeing regularly? When was the last time you had an exam by them? I always ask the question, this sounds funny, do you have two testicles? Are you doing your own self-examinations? And those are the things that I ask to try to overcome those small barriers or issues in the temporary situation. I do recommend, though, if you can at some point get someone in to do an exam, especially in the fertility space, definitely do so. And I do recommend you review this paper. So let's get into direct-to-consumer care, because I think that this is really what we really need to understand about. So direct-to-consumer care is direct marketing of medications to patients. That's pretty much how it works, right? These companies offer highly branded, patient-initiated treatments by facilitating self-diagnosis. We've seen commercials, we've all seen commercials, ads on podcasts, on social media, on TV for these things, right? And they don't say, do you have ED? They say, you have ED, here's a medication, right? That is literally what they're doing. And how do they make money? They make money by selling those medications. They are providing a service to give you a medication. They are providing you a medication is what they're doing, right? And you have to understand, comparing us to them is very different, right? Because they are saying, here's a medication, you have ED, here's a medication. You come in to see us, oh, you have ED, let's figure out what's going on, let's run some tests, here's some options for you, what satisfies your needs at the time. And it is a difference. And I'm not saying this is wrong, but that's what they do. And we really want to understand the space. And this is what I think is so important for us. Why are patients going to DTC? Well, first things first is privacy is the priority. I cannot highlight that enough. Stigma in men's health is real. We have the data to prove it. So we did a survey of men under the age of 40. We surveyed them asking about erectile dysfunction. We asked them whether they've used medications, how they got the medications, and what their considerations were for how they went that route. And we did the same thing for TRT. And we presented this data yesterday on TRT. We've published the ED. But basically, guys are saying that for TRT, they want safety, they want privacy, and they're willing to pay more for it, right? They're prioritizing their safety and their privacy over cost. And the same thing with ED, they're prioritizing privacy over cost. And, we know that men in this space are not getting care from urologists. Urologists were only about 28% of the time giving the patients TRT, 15% of the time direct to consumer. It was actually way less for, I'm sorry, that slide's a little small. I was trying to fix it, but PCPs were actually leading the way. Urologists were a smaller portion, and direct to consumer was about 25%, I believe. And we know young men are interested in addressing their health concerns, but they're not coming to us, right? 39% of the men under 40 had used PDE5 inhibitors. 39% of men were considering supplementing testosterone in some way, and about 14% reported using a TRT. And just about the TRT, what was interesting and concerning is, although they prioritized their safety, we know that at least 50% of the guys who said they were using TRT had a history of using SARMs, history of using anabolics. So they were using things that weren't regulated or really being provided by anyone who knows the space would be offering. So it is concerning, and it shows that we are needed. There is a desire to talk about these problems. So why did DTC become popular? How did we get here? Well, we do know that there was a 1,500% increase in online visits to direct-to-consumer platforms. This was in 2019. I can't even imagine what the numbers are now, right? 11 million sites visits in DTCs in fourth quarter of 2019. 2020, 20% of all DTC visits were for ED, the second most. Actually, the first most is something that we also have a prioritizing in, UTIs. So that's another space that we are not talking about when it comes to direct-to-consumer care. And we know, like I said, of men under 40 using ED and TRT, 31% and 15% obtained them from direct-to-consumer platforms, respectively, from the data that we found. And who's more likely to use direct-to-consumer? A great paper out of Northwestern, younger men under the age of 40 with mid-range incomes and those concerned with low testosterone. Exactly the kind of patients that we see or we should be seeing. They're not coming to us. So what are the benefits of direct-to-consumer? Because I'm not here to knock direct-to-consumer, I'm here to understand it, right? Well, there's patient-provider interactions on demand. You say you have ED, you want a medication, you text HIMSS, you text Roman, boom, you have a medication right away. I don't have to call a doctor, make an appointment, wait 2 months to get a medication. It's just fast. You have access for people who don't have insurance. They're taking cash. It's cash pay. You don't have to navigate your insurance. You don't have to worry about these things. Once again, I think one of the most important things, the privacy, the anonymity of it. You're on your phone, you get a message, you do telemedicine, you're in your office, you're wherever you want to be. The medication is sent to you. It's for these ED meds. It's a private. You don't know what company is getting you're getting the product from. So everyone is respecting that privacy and anonymity, and it's convenient. There's no question about it. No trip to the office, no trip to the pharmacy, no time off needed. You're getting what you want when you want it as fast as possible. And the benefit that they are also providing all of us is they're destigmatizing these conversations, right? I mean, I've never seen more guys talking about their penises. I've never saw more guys talking about low testosterone. And yet, we're still not getting those people into our offices. They're going to these places. So they're doing us a service there. They're helping us. But obviously, there's limited no contact with prescribers on these platforms. They're overlooking potential morbidities or lacking full health assessments. They're not seeing the big picture like we do. There is questionable provider knowledge and background, I'll mention in the next slide. There's conflicts of interest, right? And this is one of the funniest things. All we get is messages on social media. I'm part of big pharmacy. Big pharmacy's paying me. Dude, you're literally going to a thing that is actually just a pharmacy. And you're paying someone who is their only goal is to sell you a medication. I think it is so funny that patients have no problem with direct-to-consumer, just paying them for a pill, wherein you come to me, then I offer you options, and then you get a medication, and I'm the one who's promoting big pharma. It's a really weird concept to me. And then there's always concerns for guideline-based care. Cost, right? It's more expensive, of course, direct-to-consumer TRT. ED is as well. I'm trying to speed this up because I went a little long here. But we know that. But once again, patients don't care. If they're able to get it conveniently, they're able to get it in privacy of their homes. I do want to highlight the DTC discordant care. I was a secret shopper. This was published in JAMA, I think about 2 years ago now. I played myself, 34-year-old man. I had signs and symptoms of low testosterone. I went to 7 direct-to-consumer TRT clinics that were providing care, all 50 states. and I said, hey, listen, I have these signs and symptoms. I want to preserve my fertility. I got a testosterone level. My testosterone was 675, not to brag, but so obviously I was not even close to being a good candidate for TRT. 6 of the 7 platforms offered me testosterone. I asked them, what is my goal testosterone level? My testosterone is 675. They said at least 1,000, or we'll go, 50% of them said at least 1,000 or higher, however it takes to make you feel better. And so this is obviously a concern. People are not aware of the risks. They're not aware of the benefits. And we have to make sure that we are the people who are protecting our patients. Conclusions, recommendations. So what's the point of all this? Telemedicine, TRT, it can be done. Juan talked about it. We came up with an algorithm that we published. It can be done, and you should not be scared to do it because it is a service that we should be providing. Other conclusions. Direct-to-consumer, it is here to stay. So you can't be shitting on it. You can't be like, oh, screw these things. They're here to stay. They provide a service. They're normalizing men's health conversations. And to me, I think they are a great gateway for a lot of our patients. I can't tell you how many patients who weren't thinking about their penis or weren't thinking about their erections came to me because they said, hey, doc, I got 20 milligram of sildenafil from one of these companies. It doesn't work. I came here now. Or, hey, doc, I went to this DTC. I didn't really like how they were doing it, but it got me thinking, and now I'm here to talk to you. So we're going to be seeing more of this carryover, and we have to really understand that they're getting people in. We need to understand the limits and risks and advocate for our patients. And final recommendations, review the white paper. Don't fight the inevitable. Direct-to-consumers here. I think it is our friend, potentially. It's not our enemy for sure. And you want to create a pathway that works for you. Thank you.
Great. Thanks, Justin.